I suggest we start because our colleague is trying to connect. Hopefully, it will be solved, but maybe we can move the presentation so that he's able to join. And otherwise, we'll do our best to then insert his presentation in the recording of this event. So yeah, good morning, everyone, and thank you for being here early. I'm Juan Fernandez Ochoa, Campaigns and Communications Manager at the International Drug Policy Consortium, the network of over 200 organizations, civil society, community-led networks that come together in the belief that drug policies can and should advance social health and human rights. Social and human rights. Ooh, that sounded positive. Maybe Chibuike made it to the room. In this role, I've had the privilege of coordinating the Support Unpunished campaign for the last 8 years. The campaign is a decentralized global initiative that today brings together more than 300 local partners in over 100 countries, advocating for sustainable drug policy rooted in principles of harm reduction, decriminalization, and community leadership. I'm honored to be here, joined by colleagues whose work I deeply admire, and I'm very grateful to be in relationship to, and whose experiences illustrate what's at the heart of this event, which is that civil society and community-led responses are not just a nice to have, but an essential component of effective evidence-based responses. Very often, there were some of the most innovative and transformative responses begin. This is not accidental. It reflects a simple reality, and that is that people who live with the consequences of policies often better understand the harms, but also the solutions before public institutions do. Yep. I'm invested in drug policy personally for a few reasons. I'm from Latin America, a region that is enmeshed in the violence of the so-called war on drugs. And this history very often is narrated in terms of hectares eradicated, tons of seizures, and criminal networks dismantled. But it is most commonly reflected in street violence, families torn apart by incarceration, and unaddressed health needs. As the world faces intersecting crises, it is fundamental that we question how we got here and whether we will continue to do the same in the face of systemic failure. I also come to this work as a drug user activist, bearing the pain of seeing friends and colleagues struggle to find compassionate support and even push to premature death as a result of the trauma of criminalization, marginalization, and widespread neglect. I'm not here, however, just in resistance, but also in hope, because I believe a different future is possible, and I catch glimpses of it in the work of my colleagues in this podium, including through their work in the Support Unpunished campaign. An example of this comes to mind in relation to the last Global Day of Action of the campaign, which is every year on the 26th of June. And with fellow drug user activists and allies, we built a model overdose prevention site in London to show people one of the things our neighborhoods and our local communities could do to interrupt the country's skyrocketing drug-related deaths. I spent a big chunk of the day chatting to a man from a nearby homelessness hostel who was interested in what we were doing and joined us all day. When we were packing up, he came to us and asked how he could continue to be involved and said something that I still remember, and this is why I'm sharing it. He said, during the hours that I've spent with you, I would usually go through 4 or 5 pipes of crack. But he only started feeling cravings when we were closing. We were not there to stop anyone using. That was not the purpose of the day. But in that afternoon, feeling safe, in community, connected, smoking became just secondary. As drug markets expand, and I hear governments talk about the need to redouble efforts to punish, police, and exclude, I think of that experience and how different the world would be if a fraction of the resources that go into making people feeling unwelcomed actually went to people feeling welcomed rather than disposable, part of the solution instead of the problem. Across the history of public health, some of the most pivotal interventions did not begin in ministries or in the halls of the UN, but in communities. Needle and syringe programs, STI prevention programs, naloxone distribution outreach, Many of the practices that we now recognize as essential public health tools were pioneered by the very people being crushed by the crises that they were responding to, often in spite of the law. At a time when many grassroots organizations are facing shrinking funding and increasing political pressure, supporting these initiatives is more important than ever. It is a matter of democratic principle, as it only makes sense that the communities who live with the consequences of existing drug policies and shape their future direction. It is a question of normative alignment because international human rights frameworks increasingly enshrine the meaningful participation of affected communities. And it is also pragmatic because local community-led responses are more trusted, accessible, and adaptable, reaching the very people that formal institutions very often fail to reach. Over the past decades, through the campaign, we have nurtured a global movement of organizations across the world, most of us in the Global South and most of us from grassroots networks. Through street mobilization, community workshops, parliamentary engagement, media training, the arts, and many more, campaigners not only demonstrate that change is possible, but start to build it themselves. A 10-year evaluation of the campaign, supported by the L2 Donate Foundation, suggested that our transnational campaigning efforts has led to lessened stigma, including in the media, improved dialogue with policymakers, stronger local networks, greater confidence by community organizers, and positive change at the domestic and local level in terms of drug policies and practices. And the initiatives that we're about to hear about are powerful examples of what this leadership has looked like. As much as conversations in these spaces often focus on substances, on markets, and financial flows, drug policy ultimately raises a more fundamental question, which is how societies choose to respond to difference and vulnerability. Support and punish campaigners remind us that solidarity and care are far more powerful than responses that are anchored in punishment. And without more of an introduction, I would like to give the floor to Sally Gander, Human Rights Officer from the OHCHR, to just give us a few introductory remarks. Thank you so much.
Thank you, and it's really wonderful to be here. Distinguished delegates, colleagues, and friends, it's an honor, and it really is an honor to join this side event. Thank you to the partners and the co-sponsors for convening this. Our title today, From Punishment to Power, captures the urgency and the promise of this moment. And I think in today's world where we often see not the promise, the opposite of that, it really is important to have these conversations. Around the world, communities are showing up. Drug policy does not have to be rooted in fear, stigma, and criminalization responses, but instead it can and ought to be grounded in dignity, rights, and collective strength. The Support Don't Punish campaign continues to highlight how drug policy reform that is community-centered and led, as well as human rights-based, has yielded demonstrable impacts. Today's event we'll be hearing from, and I'm not sure, but I've heard from some of the speakers at other side events. I'm very, very excited to continue hearing and learning from them about the impactful projects and work that they're doing and how it really is making an impact at community level. So we'll be hearing from the experiences of civil society organizations and community groups working on human rights-based policy. The original aim of the 3 international drug conventions was to protect the health and welfare of humankind. However, OHCHR's report on drug policy at the Human Rights Council 54-53 showed that the current drug control policies have primarily taken a punitive approach to suppress the market in illicit drugs, with many countries adopting repressive policies. These approaches have failed to achieve their stated goals of reducing harm or eliminating illicit markets. Instead, we've seen overcrowded prisons, fractured families, and cycles of marginalization with a disproportionate impact on people living in poverty, on women, on young people, and on racial and ethnic minorities. In addressing these, OHCHR's report recommends states adopt alternatives to criminalization and zero tolerance or elimination of drugs approaches by considering decriminalization of usage and responsible regulation of drugs. That's why today's conversation is so critical. Grassroots movements led by people who use drugs, by women's groups, by indigenous communities, and by youth networks are shifting the paradigm. They're demonstrating how community organizations can reclaim power, demand accountability, and shape policy in a way that insists that human rights are not optional, but fundamental. They're also demonstrating how important it is to protect, resource, and expand civic space. I'm going to say that again. Protect, resource, and expand civic space. CSOs are often the sole providers of essential services in under-resourced settings. Cutting funding in such fragile situations is tantamount to cutting off the future for so many people around the world. Because of this, solidarity, conducive and enabling space to operate, and strategic alliances are vitally important for effective advocacy and improved health outcomes. It's incumbent upon states to engage with and resource civil society and community organizations, while also protecting civic space, participation, and accountability. These are prerequisites for developing effective human rights-based drug policy. Let's work for transformative change in drug policy for people and societies everywhere. Thank you.
And I think the relationship and the work that OHCHR does already with communities and civil society organizations demonstrates the value of this collaboration, and hopefully is a blueprint how this can be built upon and developed. And you touch upon this question of the role of communities that are vulnerabilized or experiencing vulnerability to effect transformative change. And I'm really pleased to be here with Claudia Cardona, who does fantastic work leading and actually in collaboration, in very close collaboration with governmental agencies, and in many ways shows how this exchange between public institutions and community networks can be very generative, including in the implementation of existing legislation. So I would love to give the floor to Claudia. And what I'm going to do is simultaneously translate. Would you like, or I'm happy to. That way you get a break. Thank you for the invitation to IDBC.
Vengo desde Colombia.
I come from Colombia and from the experience of Mujeres Libres, an organization created by women who have been deprived of liberty and who decided to transform that experience so that policies respond to the realities of women who are still in prison, those who have left, and those and the families of these women. Our work was born out of the certitude that women who are deprived of liberty are not the problem, but the result, that is the visible result of policies that have decided to punish poverty. Drug policies currently create barriers separating society, and in particular poor women who have responsibilities of care. They are locked, but they're not, the structural causes that have led them to be there are not solved. To organize ourselves has been a main way to respond to this reality and also build individual and collective power within and outside prisons. When we talk about rights in prison, we do it not as external experts, but actually as peers. We talk from our own experience. We go to prisons to find women who are still there and create spaces of dialogue with them. Many of them, it is shocking to see. It is shocking for them to see how people who were in the same situation are now effecting change to talk to them and talking to them.
Estos son proyectos también nuestros para nosotros.
These gatherings are also transformative for for us.
Llegamos desde otro lugar.
We come from somewhere else.
Antes fuimos señaladas,
Before we were pointed out and stigmatized.
hoy regresamos para compartir
Today
conocimiento
we
y
come back to
acompañar a
share
otros.
knowledge and support others.
Cuando una mujer con experiencia en la
When a woman who has an experience of
reconoce como lideresa,
deprivation of liberty
defensora
is
de
recognized as a
derechos
leader and a human
se
rights
rompe el
defender,
estigma
we're breaking
que
the
reduce
stigma
la
that
condena
reduces
e inspira a
people's
otras.
sentences and actually inspires others.
Desde esa misma experiencia también comenzamos a
From
incidir
that
para
experience,
cambiar las
we've
reglas
also
que nos
started to
llevaron
advocate
allí.
to change the very laws and norms that took us there.
En Colombia, Mujeres Libres,
In Colombia,
junto a
Mujeres
organ-
Libres,
junto a
together
otras
with
organizaciones
other
de la sociedad civil,
civil society
academia,
organizations,
congresistas y
academics,
el Comité
Congress people,
Internacional de la Cruz Roja,
and the International Red Cross Committee
impulsamos la ley de utilidad pública
are supporting the implementation of the public utility law,
que permite a las mujeres
which allows
cabezas de
women who
familia
have been heads of
condenadas por
household and who
delitos
have been
relacionados con drogas
sentenced for drug-related
sustituir la
offenses to
prisión por trabajo
commute the
comunitario
prison
estando en
sentence for
libertad
community work
junto
in
con sus
liberty
familias.
together with their families. The Support and Punish campaign,
Además de permitir las
besides allowing us to be in connection with others through our experience, questioning the punishment narratives, we also propose narratives, responses based on human rights. It has also supported our work, strengthened our work, implementing the implementation of the public utility law. When we started our dialogue with women in prison, we realized that many of them didn't even know that the law existed. Many didn't know how they could access to its benefits. Together with the Justicia, we created a document that explains in simple language how the law works, what it is, who it can benefit, what are the requirements that they need to fulfill, which documentation they need in order to be benefited by it. And through it, we also started doing workshops in order to explain how the law works, respond to their concerns, and accompany women through the process of receiving that benefit. Today, Mujeres Libres have already supported, have 3 women who have been beneficiaries of the law working with us. They participate in the spaces that we curate, the workshops that we do in prisons. They share their experiences, they witness to their experiences, and inspire women to engage their paths towards liberty. We continue in dialogue and advocacy with legal system actors so that the law is applied fairly, including judges, magistrates of the Constitutional Court, civil servants of state institutions. They have started recognizing that we, the women who have been deprived of liberty, are working so that the law is correctly implemented. We are not just the drug offenses that we were sentenced by in relation to. With our experience, we support policies so that drug policies and criminal legal policies recognizes and responds to the specific needs of women. If we really want policies that support women, we need to support organizations like ours. We must be recognized as essential actors and be supported. We're not just an accessory of the system, we're a condition for the reform has an impact, a real impact. And we do this with limited resources despite our importance. While states are spending significant amounts in building new prisons that are just going to perpetuate violence, vulnerability, and the human rights abuses.
Para nosotras, pasar del castigo al poder
Moving from punishment to power for us means to recognize that women have agency, especially women with experience of deprivation of liberty, and also to share race awareness and support grassroots organizations.
significa entender que criminales.
It means understanding that the criminal law, criminal system, cannot only be developed through state institutions or diplomatic spaces, but also in spaces of dialogue with us and those who are still in prison. We don't ask for compassion. We ask for coherence with human rights principles that are defended here in this law. If the objective is to support and not punish, support those of us who are building real alternatives from experience. Thank you so much. Thank you, Claudia. That's the work of Mujeres Libres is truly inspiring, and I do hope that implementation of the public utility law, which can be of guidance to many other countries that are thinking through what alternatives to conviction and punishment could look like, can learn from the experience of the law and its implementation and support with the support of grassroots organizations. I don't know, Chinwike, if you were able to connect. You are joining us online. Chinwike, can you hear us? If not, then
Can you hear me? Can you hear me?
we can hear you occasionally. Can you try it again?
Yeah. Hello.
Yes. Yes.
Yes. Thank you very much, John, and thank you, everyone. My name is Chinwike Okrika. I work with African Law Foundation, AfriLaw for short, based in Abuja, Nigeria. AfriLaw is a member of IDPC. Since 2015, we have been working with IDPC to advance drug policy reform in Nigeria. And I'm very pleased to be here. Also, I coordinate West African Drug Policy Network Nigeria chapter, and where we have up to 70 CSOs also in Nigeria, working collaboratively together to advance drug law and policy reform in Nigeria. And I'm here. I'm glad to be here. I couldn't be physically present, but I'm very happy to be part of this discussion. And I'll be speaking on our recent campaign with the support of IDPC under the Support Don't Punish initiative program. We're able to work together with other partners collaboratively to advance and campaign against reintroduction of death penalty in Nigerian drug law. In 2025, we are shocked to wake up with an announcement by the National Parliament that they are reintroducing a death penalty as a capital punishment in the Nigeria Drug Law Enforcement Act. Where most of us like integration for all the efforts, drug advocacy effort we have been working on. So we are shocked to that. Everybody was shocked, and what we did, we start engaging. First thing we did is to AfriLaw, we reach out to our partners, Youth Rights Nigeria and IDPC and others that are working in international organizations working on death penalty. International, we have like up to 5 CSOs and networks that join us, and we formed a campaign, what we call Campaign Against Death Penalty for Drug Offenses in Nigeria program. Under that, we carried out some engagements with funding support from IDPC. We carry out advocacy engagements, a meeting with government policymakers, drug and justice, human rights government ministries, department and agencies. Voicing our opposition to what happened we also did an open letter to the Nigerian president, urging him to use through the federal minister of justice to reject any provision of the amended law that provide the death penalty. And we also organize a lot of public enlightenment campaign, press release, and engaging the media, campaigning against and championing for the removal of the death penalty in that as provided by the National Assembly. And we were glad by the end of 2024, the National Assembly announced again, that they are removing the death penalty from the Nigerian drug law. And that's bring to a very successful campaign against that very, very act of for us is unacceptable. And we are happy that our campaign voice were heard, the community, the civil society mobilized, and all the policymakers we engaged. We were able to campaign, and it was successful. And to be frank with you, we were able to understand the power of community organizing, civil society organizing, to tackle some relevant issues that relate to drug policy. In Nigeria, we know that we are challenged with drug-related issues. Almost 15% of our population has one case related with drugs. The drug issues is a big issue in Nigeria. And using law enforcement approach, punitive approach, has not helped us over the years. And it has been part of our work, working together through the Support Don't Punish campaign. Over this time, we have been pushing forward for reform, evidence-based, health-based, public health approach to drug control system in Nigeria. So that you can understand with me how we felt when the National Assembly, the Parliament, came with the death penalty. We are happy that we're able to confront that squarely, mobilizing the civil society and both international and national network of civil society, working collaboratively in partnership, and also getting the full support of National Human Rights Commission. These are this network of actors, helped us to challenge that single act of reintroduction of death penalty, and we're happy when it was successful. That was removed from the amended act. And what are the things we picked from this campaign? First of all, it was able to help us to bring to front to raise civil society voices in an ongoing drug reform process going on in Nigeria currently now, because after that there was another engagement, and we were invited to make an input. So that organization, collaboration, and partnership across diverse civil society, those working on criminal justice, those working on health, those working on human rights, those working on drugs, they did those combination help us to harness our strength and combine it together to confront the drug policy challenges in Nigeria. And we are happy that we are making some good progress in Nigeria. Currently now Nigeria has adopted the harm reduction strategy in the drug control, and which, if you know the history of Nigerian drug control system and the approach being adopted, you won't believe that harm reduction will ever come into fruition. But we are happy that there is some change coming up, and we are happy working together with IDPC and other partners, Youth Rights and the other network members from West Africa Drug Policy Network. We're able to confront and challenge, working together to advance the necessary drug reform and policy reform in Nigeria. We are also happy because it helped us to improve engagement. This campaign helped us to improve engagement with the policymakers and also the employment, and especially in the National Human Rights Commission, it strengthens our working relationship with them. Currently now, the National Human Rights Commission is doing a work on the criminalization of drug use in Nigeria, and we are working together currently with them to advance that intervention in Nigeria currently now. So these are the some of the gains we are sustaining, and we are believing that working together, there is a lot to be done, but we're on the right track. Thank you for the opportunity to be part of this meeting. I can take some questions. Thank you very much.
Thank you, Chimuke. I only sort of will echo something that you said in terms of your disbelief that there's now appetite for change. I want to believe that many governments, that even governments that historically have been engaged in policies that we recognize as punitive or war on drugs like policies, even among those governments, there must be, I want to believe that there must be a great appetite for thinking things otherwise, because there's no way we see the World Drug Report year after year telling us that drug markets are thriving, and we can sort of assume that this is the result of our success. And it's really heartening to see how through your advocacy, you've also built connective tissue between organizations involved in health, organizations involved in prison justice. I think that collaboration and cooperation between civil society actors, and then also in relation to public institutions, is what we should all be striving for. And I am very pleased now to give the floor to another example of great collaboration at the grassroots level that has transformed the lives of people who are part of it, and been of tremendous guidance for other groups around the world. So, Joanna.
Hello, everyone. So I'm Joanna Canedo. I'm part of Euroinput, the European Network of People Who Use Drugs, and also part of Manage, a collective of women using drugs and doing sex work based in Lisbon. What I bring to you today is a bit of both, let's say, Euroinput drug use organizing in Europe, and also from my own experience back in Lisbon. So why support, don't punish, and instead of support and punish? I saw this these days here and I found it interesting. So this international civil and social rights movement, we know that has been on since 2013 and has been facilitating advocacy and dialogue across a network of professional peers, researchers, policymakers, families, and more stakeholders pushing for just and human rights-based drug policies. Okay. Furthermore, the Support and Punish platform prioritizes the meaningful participation with people with living experience, not only lived experience, and consider inclusive participation by different voices as a cornerstone for effective and long-term policies. Promoting meaningful participation requires addressing power imbalances, first of all, and reducing barriers to involvement. As we know, stigma and criminalization act as major barriers for people who use drugs involvement in policy. What we do in Support and Punish is to create platforms where mostly, and I work with Euroinput for the campaign since 2020, we try that those that are always excluded from policy settings and those more marginalized in our society have the space to create new and desirable futures. I always used to say that denying our participation is a public health failure. Every year in Support and Punish, we fight back the war on drugs with joy and resilience. And that is the part I would like to highlight here. For us, the Support and Punish Day is the happiest day of the year. Truly, I mean, I can give you an example. By 2025 now, we didn't have money. So I think I had 2 days are free to work for Euroinput. We had maybe 3 or 4 grants for our drug user groups. And you know, we had 25 organizations participating, user-led organizations or collaborating with the drug user unions participating in Europe. For me, this is the type of example I would like to give as a community resilience and joyful participation, the willing of, despite the absence of funding, to keep on doing our activities. And this is not only to gather people, because of course, Support and Punish has been acting as one of the few opportunities for drug users groups to get together once a year. If it was not Support and Punish in many corners of the world, we didn't have the chance to get together. And this also happens in Europe, because the sustainability for drug user organizing, as we know, it's not acknowledged. Our ability to demand the restructuring of power imbalances to participate in policies most of the times not only denied, but also not funded, not sustainable. So when I see like 25 groups participating, and I ask you, Marie, if you could change the slide, just to give an example. So last year we had RATS in UK, we had the FHR Trolar in Norway, we had the Scottish Drug Forum in Scotland, CASU in Portugal, Manuel also in Portugal, Juventus Link in Montenegro in the Balkan countries, Beer Nuts in Greece, Eaton Wood and Isla in Italy, Ariel in Slovenia, Yes in Germany, Berlin in Germany, also in Berlin, Mantlagalet in France, it's missing in Novel in Marseille as well, Arut Beers in Switzerland, Unizet in Czechia, Kattenput, Chadut and Brema, and of course Medicinaires in Catalonia. Multi-harm reduction, and then other organizations that are not necessarily drug users groups like Transform UK, Anyone's Child, APTES and GAP, that are mostly NGOs that foster peer participation. That's what we need as well for drug user organizing. And I brought here an example of Arut Beers. Well, it's in German. I cannot do the exact translation, but they did an event to advocate for safer supply, peer-to-peer safer supply for cocaine. They are being part of a pilot in Switzerland that has now maybe a bit stopped. But so we enjoy this day to really fight back the prohibition of drugs and to generate new responses. In between the activities that happen in 2025, I would like to highlight media publishing, the adapting existing harm reduction services like drug consumption room to gender affirming and expensive service. Neighborhood activities, because most of all, we as people use drugs, we are neighbors of everyone else in the city. And this goes in line with the right to the city. Dialogue with European agencies. So I've been invited a few times to be in the European Drugs Agency, UDA now, for do this dialogue and presenting our Support on Punish campaign. Advocating for peer-led safer supply, and as I explained already in Switzerland, creating new spaces for consumption, or let's call it pop-up stores, which is like we are not really allowed to make it, but as in Manas, as RATS, we did some pop-up initiatives. I call it like an exhibition, which is not an exhibition because we are a living part of it, but basically to show to police, authorities and neighbors that they should not be afraid to say yes in my backyard drug consumption room. And then the importance of peer groups, because we need the space to gather, and from that space, and we don't need exactly an institutional setting to do that. We need that associations, local neighbors, other social movements to understand that we are also a social movement and that we need space. And once we get a space to get together, solutions appear and community feels safer to also ownership, not only the campaign, but to fight mostly the stigma we have internalized for years. So coming out of the closet. Can you go? Yeah, this is just some examples. I would like to highlight that for past years, 4, 5, 6, I can count. We've been collaborating with Mali, which is a Barcelona-based artist. She always listened to our demands and she transformed it into art. This is an example of the 2022, 2023, 2024 posters. We don't only address, let's say, the punishments and the drug policies, we also try to address other oppressions with intersectionality in the oppressions. And we use the posters also to demand for safer supplies, safer spaces, drug checking, to end stigma, human rights, drug policy, etc. And Marie, I think this is maybe the one. Oh no. Okay, here are some examples of RATs. We need safer drug use spaces. UK last year, some dialogues in the EUDA drug summer school like 2 years ago. Here, minus in Lisbon, it says we are neighbors, we are resistance. And yeah, this went from brief to fight back the war on drugs because one of our mates died near support on Spanish State. So we did like this big graffiti and we recalled on well, the importance of safer space for women using drugs, as most of these incidents happen by night. And so yeah, the right to life, I would like to refer here. And again, I think I'm finalizing. So just more actions, Shadow and Medicinaires and Tema and Catherine Foods in Catalonia. Manas again, Cosmic Care and Youth Rise in Portugal, and Greece, Earnaps. Well, we also have something to say about the existing harm reduction services, and in Greece they did this action because it seems like the drug consumption room available is pretty much medicalized and police enforcement pretty much visible outside and door. And yeah, when we are loved, we are afraid love will vanish. When we are alone, we are afraid love will never return. When we speak, we are afraid our words will not be heard nor welcomed. But when we are silent, we are still afraid. So it is better to speak, remembering we are never meant to survive. This is Litany for Survival by Audre Lorde, and thank you.
Rana, for years of collaboration.
Thank you to IDPC for this.
From us, like our biggest purpose is to support organizations precisely that usually do not have the resources to mobilize and who nevertheless do incredibly important work to, as Rana said, change mindsets at the local level, refine policy implementation, improve access to services. These are all desirable outcomes that I think I know.
I think I forgot to mention that when you do this at regional and local level, we are so fueled change at international standards.
And many of the most visionary, I mean, I was mentioning, for example, before needle and syringe programs, we have to think that it is because local drug user groups were doing needle and syringe programs or the distribution of hygienic needle and syringes in the 80s that when the worst of the HIV epidemic came to be, there was already community technologies that were ready to be amplified. Yeah, like Junkie Bound in Amsterdam, in San Francisco, there were also drug user groups doing the same. And now these are recognized as part of the comprehensive package of responses to HIV among people who use drugs. So I guess in the back of my mind, through hearing all of these experiences, what I'm thinking is like, why wait? Why receive this constant oppositional attitude rather than sort of seek the collaborations that we know can be very fertile? And another thing that I would highlight of what you were saying is the work of going to communities, because this is not sort of nombreliste, how do you say that? This is not navel gazing work. Like a lot of what we do is actually reach out to our communities and demonstrate that we are neighbors, we are families, we are parents. As Claudia has just also highlighted, we're not this monstrous, mysterious other, but definitely part of the solution. And a group that has done great work in terms of narrative change is Kun, and I'm gutted that Tatiana Sleiman is not with us, but I'm in person, but I'm very glad that she was able to join us remotely to talk a little bit about Spoon's work. Tatiana, the floor is yours.
Hi everyone. Can you hear me?
Very well.
Oh, I can only see my face now. I don't see you guys. So hi everyone, and thank you IDPC for inviting us to join this conversation that we're also super passionate about. SDP has been, Support Don't Punish has been a very important moment in our years and years of advocacy. My name is Tatiana Sleiman. I come from Lebanon, from Beirut. I'm in Beirut right now. I'm a harm reduction and health system reform practitioner and advocate. I also work with an organization called SCOON, which is a harm reduction center in Beirut. I would like to take a minute before I start my presentation to send my solidarity with my people, the people of Lebanon, who currently are facing yet again another Israeli aggression. Over 700 people have been killed and almost 750,000 people have been displaced in less than 10 days. I also send my thoughts and solidarity to the people of Iran and Palestine who continue to face the unimaginable. On a brighter note, I will be talking today about our history with the SDP campaign, a campaign that I believe SCOON engaged in for the first time in 2012. I will share my screen. It's not really a presentation that I prepared, just a collection of old and nice photos, ancient photos. So let me know if it works. Can you see it?
Yeah, we can.
Okay, perfect. So basically, SCOON started with the SDP campaign. We knew very little about it. I think it was the year 2012. And we started with something that was really very basic, very organic, very grassroots. It was really just, printing some flyers, printing some posters, holding these posters, taking photos, posting them on social media or going down to the streets through outreach interventions and just using it as a medium to talk to people. Lebanon is a country where drug use continues to be criminalized, but at the time it was much more heavily criminalized also in practice. And people who use drugs were extremely marginalized and stigmatized. And opening a conversation about drugs was very difficult at the time. And SDP created a very simple and accessible medium to do that because of how broad the title was. Support Don't Punish. If you don't know the campaign, the first thing that you think about is not necessarily drugs. It's a message of care. It's a message of community. It's a message of solidarity. And it's a message that a very broad public was able to identify with and feel included in. And this is why it created a very easy pathway to be able to speak to people. Our initial campaign started really with something very simple, which is to really go down the streets and holding this message of Support Don't Punish and asking people, what does Support Don't Punish mean to you? Or the way that we say it in Arabic, or the way that's been translated in Arabic is ندعم لا نعاقب. And it's a nice nuance for those who know Arabic, because ندعم لا نعاقب is actually we support, we don't punish. It's just a very simple nuance that came in the translation because it sounded better, but there's actually also this agency of people and community when we say we support, we don't punish. And we really went everywhere. We would talk to people from all different backgrounds, ages. And this message grew and people started recognizing the message more and more. And it became a message that linked people to SCOON as an organization and to other harm reduction and human rights organizations in our country and our region. And through that medium, people started getting to know more and more about harm reduction, about drugs, about legal rights related to drugs and drug use. Because at the time, also due to stigma, people knew very little. So they understood, if you are not a person that used drugs or came from the family of someone who used drugs, you knew very little about the implications of punitive drug laws on people who use drugs. You knew that they were criminalized, but what did that mean in reality? What did that mean to people who were in universities? What did that mean to people who would get arrested? What kind of trauma they would suffer when they would go into prisons, when they would go into withdrawals and detention centers? People had no idea. And SDP became a medium to also tell these stories. It opened the door to tell these stories in a way that became more accessible to people, in a way that really humanized people who use drugs, which is maybe evident for us now, but at the time, again, it was a conversation starter. And from that moment onward, it really moved to becoming broader. So, we took it to bigger communities. I mean, in these photos you see, for instance, the first photo is a group of waiters that work at a restaurant who on Support Don't Punish Day would start wearing Support Don't Punish pins. And then it was people to people having this conversation. We didn't even have to be there. But it was those people who became advocates with other people to tell them about this campaign, tell them what this campaign is about. And it made the narrative gradually change. I cannot say that there's a piece of research that we have in Lebanon today that will directly link the Support Don't Punish campaign to a change in narrative or a change in mindset. But what we do know as practitioners who have been in the field of drugs for decades now in our country is that although not much necessarily has changed in laws or policies in our country, what has changed drastically is the practice. And when you talk about practice, it's the bigger community. So it's the community of people who use drugs, but it's also the community around them of advocates, of health practitioners, even of people who work at ministries, at hospitals, at university. So it really grew into a community that supported one another, and that even if the law hadn't changed and was still a criminalizing law, they could see that a lot can be done in practice to improve the daily lived realities of people who use drugs. And Support Don't Punish played a big part in that because it was a moment in time, it was one day in time, but what happened before and after was continuous. It was a conversation starter that would not end in that very specific moment of June 26th. And throughout the years, I think you can recognize this really cool dude here in the photo. Do you recognize this cool dude or not? Anyway, this cool dude right here. That's Jamie, in case you haven't recognized me yet. But from that point onward, we started also taking this message beyond, just street interventions. We started talking to policymakers. We started hosting discussions with journalists, with ministers. I remember, I think it was the year 2013, we printed posters of Support Don't Punish, and we organized a sit-in the Palais Justice, or I don't know if the actual translation is Justice Palace, but it's basically the courts. And it was a moment for us to talk to judges. And this moment preceded when we had the activation of the Drug Addiction Committee, which became the medium through which people had an alternative to incarceration when they were arrested for drug use. So it grew. It started becoming, also we grew in terms of understanding of what we could do with this campaign. And we were able to start centering it more on discourse around harm reduction and decriminalization. And it became a really solid instrument for advocacy, which we continue to use up until today. Even during recent years, when we started facing more security challenges, resource shortages, so we were able to do less maybe on the field, we were still able to use this moment to do digital activations and campaigns for Support Don't Punish, use this moment to issue statements, for instance, that would be signed by different organizations working in human rights and on human rights in Lebanon, to push for decriminalization, and not just decrim, but also an investment in the support services and the protection services for people who use drugs. And once again, while there is a shy advancement in the actual law reform, we have really seen mountains being moved when it comes to practice. And this campaign was also taken outside of Beirut, and it was decentralized, and it has allowed us to push the discourse towards, safe overdose reception, expanding the network of service providers that will provide support for people who use drugs, and also to submit new amendments and law reforms that continue to be discussed in Parliament. So overall, looking back on the Support Don't Punish campaign, we see that it's a message that was accessible, but also was very memorable. And people, because it was such a global movement and because it was gaining traction year after year, we could see that people became very proud also to become part of this umbrella of Support Don't Punish. They felt like it was a movement that really went bigger than just drugs and drug use. Even if it had drug use at its center or its initiation, it became a movement of community care, of solidarity, but also of power and agency for people to change their own realities, even if governments were not changing those realities quickly enough. And it's a campaign, obviously, that we continue to build on. That's very dear to our heart. This is, for instance, the flyer that I have here. This was probably in 2015 or 16, where there was a World Cup event. And basically what we did is we went to pubs and bars where people were watching the World Cup, the football World Cup event. And, you know, during these periods, people will draw like flags on their faces. So we went and started drawing Support Don't Punish logos on people's faces. We had balloons of Support Don't Punish. And again, we used that moment to open conversations with people. Our network of allies grew because of this campaign, and, you know, beyond and after this campaign, our network of allies grew. And it also included allies that, you know, were working with donor agencies, that were working with ministries, that were working with other organizations that were human rights based, but that up until that moment did not really have people who use drugs or the criminalization of people who use drugs on their agenda, and then they did. So overall, this is really our journey with Support Don't Punish. It's been a very important moment for us to build our advocacy strategies, but more importantly, to build community and to find a simple and inclusive medium to talk to people about topics that otherwise they would be resistant to engage in if they had maybe, you know, drugs or drug use or people who use drugs at the center. And of course, this has changed the narrative a lot today. Today, we can go to the streets and talk to people about drugs immediately because we have been able to shift the mindset throughout the years. So I will stop at this. I will end by thanking IDPC, who have been on our side every single year with the SDP campaign, whether in providing us with resources or support or guidance on SDP and beyond. So we're very happy to continue to collaborate. And yeah, I would stop at this. Thank you.
Thank you so much, Tatiana. We have 1 minute and I want to leave it to the floor in case somebody has a question. But I wanted to highlight just the universality of this message. I think like very often in narratives around drugs, like the depiction of people who use drugs and other communities that are affected by the war on drugs is that there's almost like a death wish or an investment in our self-annihilation. I think the work of all of these organizations demonstrates that our investment is in life, and we can meet there, even if we have different opinions compared to other groups on how we will positively respond to drug-related challenges. We can meet in this acknowledged commitment to each other and our own lives. So if you have any questions, please.